going forward, we might not continue to see a sufficient performance as it is. So that is what I can say about this sustainability. But I foresee that it's a very good program that should continue to run in this country. And therefore, all of us parliamentarians will have to put whatever efforts we have to make to enable the executive or government to continue to support the schemes. Thank you, Honorable Chair.
Honorable Minister, you talk about premiums, but I know that health insurance has two components: the premiums paid directly, and then the SNIT contributions, as well as what is paid on services. So which one do you expect that we should increase to be able to make the scheme sustainable?
I would say both the levy and premiums that are paid by individuals.
What about the SNIT part? Is that sufficient?
The SNIT part invariably is a small component of the entire health insurance resource. And since SNIT is part of people's pensions, I would dare to say, if I become part of those who make that decision, I will fight and advocate that we don't touch the SNIT component at all.
Chairman, since the nominee is an economist, increase the levy by what margin? And does the releases from the Ministry of Finance to the NHI include bonds, to your knowledge? Bonds?
Thank you, Honorable Chair. It includes bonds because there were debts without money sitting in finance to pay. The areas that was left for us to inherit, Honorable Chair, we didn't have money that was supposed to come from finance. So the Minister of Finance couldn't use current levies to pay for debts. That levies are collected and probably relocated somewhere else. That is why the Minister will have gone for bonds. It was part of our suggestion because we needed money to ensure that health insurance continues running.
You know how much bonds have been issued to the National Health Insurance Authority?
Faint memory, I'm not very sure. We close to about 400 million Ghana cedi. I said I'm not very sure. I can actually cross-check and give you the exact amount.
Honourable members, let's get the rules clear. I called for the notes to be clear. 3 questions clear. If there's a need for follow-up, it should be from the answers. That's why I'm stopping the Chief Whip from asking another question. Yes, Honourable Samson.
Thank you very much, Mr. Chairman. Mr. Chairman, in one of the broadcasts to the nation by the President with regards to COVID-19, he said the President promised that his government was going to construct 88 district hospitals. And then on July, when the President met the chiefs and elders from Bolgatanga and Bongo and Talensi, the President was specific that those 88 hospitals was going to commence in July 2020. We are in February 2021. Can you tell this committee how many of those 88 hospitals have been built so far? And where, if you can mention those districts to us.
Thank you, Honorable Chair. That was the President's vision, which was supposed to have been translated into action. Seriously, the President set machinery in motion. He set up a committee in the presidency, chaired by the Chief of Staff. I was a member. We pulled 1 or 2 infrastructure directors from my ministry, Ghana Health Service. There's also a fair representation on that. What they asked us to do immediately was to write to district directors for health services, and the local government minister was to write to all these assemblies for them to allocate land and give us the site plans of where they wanted these districts hospitals to be cited. As I speak, we still have close to about 13 districts that have not completed that exercise. Some of the districts, after we got the initial responses, there was a team that was set up. A coordinator has actually been appointed to coordinate this because the work volume is so huge, said that added on to our ministry's work in the midst of COVID will have meant that we wouldn't move at all. So they sent teams into various zones of the country that have been divided by the coordinator and the team that is working on these 88 hospitals. Some of them have litigation matters, and so we have to find a way to settle them. We are still working on these, and contracts have been awarded, and we are waiting to do proper sword cutting for all these things, the actual construction to start. The preliminary works have actually been done. We are not waiting for the ones that have been submitted and finished with land issues, but we've started working on them. We face challenges in the midst of COVID. Things were not moving the way things should have gone. And that is why you will see we might not have started serious work on any of them. But our target was to have at least reached lengthy level by close of the year. Unfortunately, we couldn't get there, but we are working seriously on this matter.
Mr. Chairman, this is a follow-up. Nominee said that what the president said was his vision. But I've said to you that in July, the president was specific that the project was going to commence in July. So how can commencement now becomes a vision?
Honorable Chair, what I said was that President vision that should have been translated into action. And that translation gave us a roadmap. And that is how come the President said we'll start in July.
Mr. Chairman, thank you very much. Can you tell this committee how much it will cost to construct one district hospital and the total cost for the 88 district?
Mr. Chair, the initial costing was done on the basis of averages. And we're looking at between $5 million to $7 million per hospital. On the issue of equipment and other logistics came in, other equipment came in, we were still thinking that a maximum $7 million could do what we should do. If you multiply this by 88, and the 88 has even changed to 111. We're adding on regional hospitals for regions that do not have regional hospitals, especially the 6 new ones, plus the western region, the northwest, southwest region. And then we are also rehabilitating Ufiankwanta Hospital. This, together with other places that we left out when we're counting the District Hospitals 88, have brought this number to a total of 111 at the moment. That is what we are working on. If you look at the minimum 5 million and the maximum 7 million multiplied by the numbers that I've mentioned, take away the regional hospitals because they may come at a different cost. This is what it is. When the team went round, topography of land and all that is indicating that prices might not be uniform across the country. In some places there may be some escalations, in some places it might be probably lower. So we are still computing, and unfortunately at this stage, if I can tell you exactly how much the total will be, it will just be an estimate of what I've said. 5 times 111 minimum, 7 times 111 minimum. That is what I can say, Honorable Chair, for the question.
Chairman, just a follow-up. So if I did a little arithmetic, 7 times 101, do you have that on budget? Is it budgeted for? Or will it be budgeted for?
Mr. Chair, definitely without a budget we cannot utilize the money. And this question, I think finance will be able to actually put in. To the best of my knowledge, there is a provision, and finance has assured health that they are sourcing and have achieved some portion of sources that will do the work. So I wouldn't be the most appropriate person to answer this budgetary question, Honorable Chair.
Yes, Honorable Samsey.
Thank you, Mr. Chairman. Mr. Chairman, now that the COVID situation is becoming alarming and the numbers, affecting numbers is increasing, the minister is aware that there are some regions that do not have ICU facilities as we speak. What are you doing to ensure that those regions, when they need that services, they will be able to get it? Because I know that Western, for example, don't have ICU, OT region don't have, have origin don't have, but they are supposed to benefit or enjoy such facilities. In the absence of ICU, what are the immediate steps you are taking to ensure that those people are catered for?
Honorable Chair, at the onset of COVID onslaught in the country around March last year, the first instructions went from Ghana Health Service and the ministry to all these hospitals to create spaces to fight the COVID battle. Honestly, these hospitals have never had intensive care units to the level that can take care of COVID, severe and critical COVID patients. So we kept on referring to the regional and, how do I call it, the teaching hospitals. In the midst of that, after having evaluated the inadequate infrastructure in our facilities, we earmarked about 12 places where we set out ourselves to actually begin to construct treatment centers very quickly for us to be able to put in things to do the type of work my honorable colleague is asking about. Places like Zebila, Goso, Sefioso, I think somewhere in Soyo also. The Dudua one is fully completed. Several places that we earmarked. Fortunately, the monies that were supposed to have utilized through the World Bank thing almost all went into procurement of PPEs, sanitizers, and face masks, and gumboots, and caps, and gowns for the doctors, and all that. So the project halted a little bit. It is only now that the second tranche of the World Bank support is giving us room to actually advance monies. We ask the contractors to pre-finance, and we will come on. And I believe by the close of this year, all these treatment centers will have been completed. But we continue to rely on our referral systems to try to see how best we can solve the problem. Luckily for us, the enhancement of the ambulance service with 307 ambulances, one for each district, seem to be supporting us a little bit, and we keep on getting patients referred in ambulances coming close to where we have these facilities. That is what I can say in respect of this question, Honorable Chair.
Thank you very much, Honorable Samsahi. Yes. Is that Honorable Member for Juso? Okay.
Thank you very much, Honorable Minister nominee, and congratulations. I wish to thank you for your efforts in the handling of the COVID-19 pandemic. At a point, you had to sacrifice by being infected with the disease in line of duty. And of course, it's a sacrifice. And you are doing all this for the country. I want to find out how prepared are we as a nation for if another pandemic is to strike. What do you suggest that we should be doing now in readiness to prevent a future pandemic in terms of our readiness in handling of such matters?
Thank you. very much, Honorable colleague. Honorable Chair, we were just about finishing the zero draft of emergency response strategy that will have eventually dovetailed into establishing a proper CDC in this country when COVID strikes us. So all those experts who were working on this strategy, including myself, had to put that one in the back burner to begin fighting the COVID pandemic. When the pandemic started slowing down and we thought that things were stabilizing for us, we were revisiting it, and then all of a sudden the upsurge that we have now. But that is a very big priority on the agenda if, Honorable Chair, you and your colleagues give me the nod, something that we're going to tackle seriously to get a fully established CDC in country before the end of the year when I get my note. The draft strategy is ready, and all I'll have to do is to do some more stakeholder engagement. I'll bring it even here to the committee for engagement, and we will look at it, pass through cabinet to come here for us to actually see it before it goes through. But I'm very committed that we will see a CDC established in the country before the end of the year. Thank you.
Mr. Chairman, one key problem in our country hospitals is the lack of beds, the no-bed syndromes. And I know that as Minister of Health, you have made a lot of efforts to address this problem. But unfortunately, this problem still exists in many hospitals across the country. If you are given the nod, what will you do to make sure that this problem is resolved?
Honorable Chair, we continue to invest into equipments into our facilities. Not very long ago, we were given some resources to have procured 10,000 hospital beds that we have distributed equitably across the country. Again, we are working on deploying e-health electronic systems that has a component that does bed management in the facilities. So that in the very large facilities, you might see some beds empty in one department, and then emergency will be full. So we can see through quickly, and reports from the system will give you an indication of how to resolve that matter. But in the meantime, we've given instructions. There are no facilities to turn anybody away on the basis of no bed syndrome. We should find a way to keep the patient, to stabilize the patient, before we begin to look at where we can conveniently transfer that patient to rest. So that is what we are doing. I believe that going forward, we'll continue to find resources to put in investments to help us resolve this matter.
Finally, Mr. Speaker, one of your key achievements as Minister of Health that you've been commended for is the introduction of innovation, drones, into our hospital services. I want to know from you how the deployment of this drone is impacting on our health systems.
Honorable Chair, one significant thing that I may want to mention is the recent floods in northeastern region after the Bagri Dam was opened, as even some parts of upper east region. Because of the drones that we have installed, several places you couldn't reach. So we were flying essential medicines with the drones to these areas. Prior to that, you will have seen people carrying drugs and their vaccination fridges on motorbikes in water, crossing these rivers to reach outlanders. But some parts of the country are now covered. We have installed 4 centers that is helping us do the work that we should do to reach people who are in very hard areas. Now, during the around October, I have been touring the country and looking at facilities and trying to motivate our health workers with my presence. There was a day we went to do a short cutting for a chip compound to be done at Drobonso, the health center. Whilst there was a problem in there, and then they have ordered the drone to bring some oxytocin to try to support hemorrhaging in a woman in labor. And the drone came at a function where we had a function, dropped the thing, and the cheers that were coming from people there gave an indication that the deployment of these drones have been very useful to this country. And as I speak, they are helping us with the immunization program, flying vaccines to areas where we can't easily reach. And I believe when we begin to do our COVID vaccination campaign, these drones will also be useful to fly some of these things. And their capacity, they even have cold chain storage capacity that will enhance our existing capacity to be able to store our vaccines in there. Thank you.
Just a little follow-up to Honorable Ejisu. Minister Designate, in your answer to his earlier question, you indicated your directive that no patient be turned away for lack of bed. You know that the doctors and nurses can carry patients even if there are no beds, and therefore it creates an obligation. Has it been brought to your attention that some COVID patients have no access to beds, and then there's critical shortage of oxygen for COVID patients in the country? And what are you doing about that?
Thank you very much. What I would say, in a pandemic of this nature, you will expect that the facilities we have would definitely not be adequate. Even in very developed systems like America and the US and Germany, this type of situation you are describing is found even there as I speak. We try to improve on the situation. Last 3 weeks or so, the new infectious disease center that we got support from the private sector fund to do for us, we linked the oxygen in the Ga East place to that. But when numbers began to rise up, we realized that that capacity couldn't do the 100 bed here and 130 bed here. So quickly we have to do emergency thing. And we have installed a new oxygen plant even in that area to work on it. As I speak, our engagement with USAID is bringing in a number of these oxygen plants to be sited. Yesterday, the memo I read through after engagement indicates where we have actually located some of them. We are saying that they should relocate them. WHO is giving us oxygen cylinders as we also strive to procure some more. And we are working very hard to try to see how best we can solve this problem. Now, the pandemic will give us some experience. And if we don't learn from this, and we continue to live our system the way the pandemic came to meet it, then it will not be a problem of only the health minister and only the current president, but posterity and all of us in the country. Thank you, Honorable Chair.
Yes, Honorable Okuje Tabla.
Most grateful, Mr. Chairman. Mr. Chairman, I would want to begin by making a few preliminary observations. The nominee will have to help the committee with the accurate rendition of his name, because the communication from His Excellency the President, number 14, Minister for Health, Kweku Ajeman, is spelled with a J, Menu not hyphenated. Your CV has Ajeman without a G and is hyphenated. For our records, which one do we go with? The communication from the President or your CV?
My CV, Honorable Chair.
I hope, Mr. Chairman, that the Presidency will reconcile these matters. The CV you have submitted to us this time around, I have cross-checked with what you submitted to us 4 years ago. And you may want to look at the Hansard of 27 January 2017. Quite a number of your dates and numbers do not quite add up. So you may want to reconcile that later. Matters to do with your basic education. 4 years ago, you told us 61 to 65. This year is 1960 to 1963, and all the way down to London School of Accountancies. The years are not matching, and you may want to reconcile that later, Mr. Chairman, if you permit the nominee. And if you also look at the face of your CV and the educational background, I do not think it's possible, F and G, that you were at the University of Ghana and at the London School of Accountancy at the same time, 1975 to 1978. I want to believe that is an error.
An error.
So, Mr. Chairman, I believe the nominee will tidy these matters up so that we can have consistent records.
Can easily be corrected. 1988 to 1980, 85 to 1988, the London School of Accountancy.
And the page 2, you have the item numbered G and H, Deputy Minister, Ministry of Transport and Communication, 2001-2003. Deputy Minister, Ministry of Roads and Transport, 2001 to 2003.
Honorable Chair, I can explain that. The first reshuffle by President Kufuor took me into that situation. I was put in charge of Deputy Minister in charge of Transport. And the first